All right, rapid junctional. So we're going to talk about rhythms that follow a lot of the same rules that we just looked at. They're just, what do you think? Rapid. Now, I am going to briefly mention here the pseudo S wave and the pseudo R wave, which will make a little bit more light on what we just saw with those post QRS P waves or whatever. But with our rapid, so you're going to have accelerated junctional rhythm. So all the rules of a junctional rhythm: no P wave, an inverted P wave, or post QRS P wave, but the rate's going to be 60 to 100. Okay? Or you're going to have a junctional tachycardia. So I know we're going to go over SVT today, but based off of what you saw the other day in lab, you remember what SVT: narrow, no P wave, and a rate that's usually greater than 150 or so. What do you think a junctional tachycardia is going to look like?
Pretty simple.
Narrow, no P wave, and it's going to be a rate of about 150 or greater. All right. It's really hard to, as a matter of fact, if you want to get technical about it, a junctional tachycardia would be considered a SVT because it is a supraventricular tachycardia. The treatment would probably be the same as well. So we're going to learn about these and all that, how to differentiate them, but it's really not a big deal between those two. If rates of a junctional rhythm exceed 140 beats per minute, it's called an AV nodal reentry tachycardia, and I mentioned that briefly last week, which again is going to look just like a SVT. And the rates between 130 to 140 can either be called junctional tachycardia or AV-NRT. For our quizzes and stuff, we're just going to kind of err on the side of, I want you to identify that as a narrow complex supraventricular tachycardia. Okay? Because one of the differentiating factors is going to be our treatment and if adenosine works or it doesn't work. And so we'll just kind of keep it at that. All right? So those are your rates and all that. So let's just talk briefly for a moment. Pseudo S wave, pseudo R wave. So this kind of looks like what we had saw earlier, right? Where I said, hey, it really should be a lot sharper with your S wave. And so sometimes that can be confusing. But what's happening here is this S wave, instead of it being real sharp like it should be, it's slurred. Okay? So that's how I know. All right? So it's called a pseudo S wave. The retrograde P wave can look just like a slurred S wave, or R prime, which we'll get to later. These are known as pseudo waves. The pseudo part is added to reflect the fact that these appear to be S waves or R waves, but are not true waves. Rather, they're merely the P wave merged in and showing on the S wave. All right. So it could be the pseudo S wave or the pseudo R wave. The pseudo R wave's a little harder to see. All right. And we're not going to see these as much right now. Okay. But we know that it should be a real sharp S wave if it's a little bit slurred, and especially if we see the fact that it doesn't have a P wave before it, then and it follows the other rules of junctional, then that's what it's typically going to be. Okay? All right, so we've already talked about our rules. They follow the rules except the rate for accelerated junctional is going to be 60 to 100. All right, so here's an accelerated junctional. 1, 2, 3, 4, 5, 6, 7. The rate's 70. So it's not a junctional escape, it's an accelerated junctional. That's the only difference when interpreting here. If we had a rate of 50, then this would be a junctional escape. But because it's got a rate greater than 60, it is an accelerated junctional. Does that make sense? All right, so what about this one? 1, 2, 3, 4, 5, 6, 7, 8. I lost count. It's 100 or greater, right? Now, this P wave really, right? And just kind of go into it, right? But it doesn't. And it has this inverted P wave right here that kind of merges on into the S or the T wave. Okay?
So if it's 60 rate, then it's still accelerated.
It's what now?
If it's a 60 rate, When it's accelerated?
If it's a 60 rate, it's accelerated. Yes.
Because on
59 and below. Actually, let's make it like this: 61 and above. So 60 and below, we're going to say, because we always say that rate is 40 to 60. So let's just leave it at that. Okay. So 61 and above, we would say that it is accelerated. 101 or above is junctional tachycardia. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let's say 100 and above. 100 and above. All right. So there's really not a lot to lecture on here other than just looking at a couple of them. All right. So figure 24, example 1. Note the absence of P waves, irregularity of the rhythm, and the narrow supraventricular QRS. The ST segments and symmetrically inverted T wave. So that's not a P wave, that's an inverted T wave. Okay. Could easily represent some type of ischemia or something associated with AMI. Accelerated junctional is often associated with AMI. So you may see this with chest pain or something of that nature. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So that's a 100 right there. What are they called? Just for rates and stuff to eliminate confusion. 40 to 60, say, functional escape. 61 to 99, accelerated. No, I'm sorry. 61 to 100, accelerated. 101 and greater is tachy. And that's what we're going to stick with, okay? Rate of 80, no P waves.
So
Accelerated junctional. That's a Q wave. That's a Q right there. And one of the reasons why I know that is because there's really no, it just goes straight into the R. All right. This patient had pre-existing issues. So this is kind of an unfair rhythm for y'all because I could see where y'all are like, oh, well, that might be, but this does just, they had pre-existing like bundle branch issues, and so that's why you've got this widened and looking like this. But that's not a pseudo S wave. That's just a deep S wave, slurred S wave. Whereas here you got it, and I can see how that could be a little bit confusing. But you got kind of a notch here versus this is just a smooth transition. It's the little things that sometimes like makes identification a little bit tough. Okay? But this is a rate of 4, 5, 6, 7, 8, 9, 10, 11, 12. So this is a rate of 120. So it's not a super tachycardic rate. This one right here, because I see there's no P wave before it, but I do see this post QRS P here, the pseudo S wave, which would be a post QRS P. I would be able to call this one a junctional tach because the rate doesn't exceed what we would go for a SVT. Same thing here. You got that pseudo S wave, got a rate of 120. T waves are exact. QRSs look very similar. So you got a junctional tach. You notice here that this kind of notches with that. So that would be where they're talking about a pseudo R wave. All right, because it kind of notches with that. But I don't love it, especially because this one is a V1. This one, cut and dry, junctional tach, 120. Same thing here. Rates 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, so about 110. They say 112 because they use the R to R method. But y'all get it, right? Junctional escape, accelerated junctional, and junctional tach. So junctional escape rate 40 to 60, accelerated 61 to 100, tachycardia, junctional tach 101 and greater. Okay? All right.